It's time to enhance the relationship between expertise and impact, between knowledge and application. Welcome to a journey of discovery and empowerment. Welcome to All Physicians Lead, the Forbes Books podcast that highlights the critical leadership role that all practicing physicians take on every day. Here's Dr. Leon Morse.
My guest today is Dr. Doreen Addrizzo-Harris, a professor of medicine at the NYU Grossman School of Medicine, where she directs the NYU Bronchiectasis and NTM program, and has served as the Pulmonary and Critical Care Medicine Fellowship Program Director for over 2 decades. A distinguished educator and leader, she's been the CHEST president among her numerous leadership roles, and is recognized for her significant contributions to pulmonary and critical care medicine, particularly in bronchiectasis and non-tuberculous mycobacterial infection. Dr. Addrizzo-Harris, welcome to the podcast.
Thank you. Thank you for having me.
Yeah, this is great. This is very exciting. We're happy to have you here, and I'm sure our listeners are going to have a great time listening to your insights. So thanks for taking some of your valuable time to join us. One thing that we always like to start with, everybody's gets to where they are through different pathways. If you would, tell us a little bit about how you ended up doing this. What's your background? How'd you get into medicine, major career decisions, and how you wandered your way through those decisions to get to the position you're in now?
I'm a Brooklyn girl, grew up in New York City. I was lucky to have a dad who was a physician and a grandfather who was an internist. My dad was a pulmonary critical care physician, and I swore that I was never, ever going to be a physician after I saw how hard he worked. I was the oldest of 4 and thought I was going to be a jazz dancer. Didn't want to go to college, wanted to dance in a studio that I was teaching in, and I didn't get my way. I had to go to school, and I decided actually in 4th year of my senior year at Penn that I really did love science. I had done some time in the hospital there on their services, as an intern, watching and shadowing. And I decided that maybe I would try it. So ended up training in New York City at Bellevue Hospital, which was a phenomenal experience. Really, really an unbelievable place to train, and who couldn't fall in love with medicine while training here and caring for all the different patients that we have here. Fell in love with a cardiothoracic surgeon in my medical school days and ended up staying at NYU Bellevue for the rest of my career. I think that's probably one of the best decisions that I did make. It's a phenomenal institution and has given me a lot of opportunities. I initially just really wanted to be a great clinician and great teacher and didn't really have many other goals. I just love taking care of patients, both on the pulmonary side and in the bronchoscopy suite and in the ICU. And I love teaching. And, I just think the way my career unfolded was just the opportunities that came up before me. The first opportunity was to be an associate program director. Then they needed a program director. Then they needed a director of the pulmonary service line. Then they needed a chief of service at one of the hospitals. And my answer for those who are listening who are young is, in the beginning, say yes to everything. You never know what you're going to love, and you never know who you're going to meet in those, do as many things in the beginning so everybody gets to know you. And then you'll get a lot of offers, and then you can start to choose and be picky. And so with my love...
and how much do you learn from all those diverse experiences, right? Things you never thought you'd learn.
That's right.
Need
and
to
you learn
know.
a lot about yourself. So in the beginning, never say no. Never be too closed-minded. Be open. And I was, and I realized that I really loved being a program director and running a fellowship program. But I also loved being in the ambulatory setting and taking care of patients in the pulmonary clinic. And I have now specialized for the last probably 12 years taking care of, or actually more than that, probably 15 years taking care of patients with bronchiectasis and non-tuberculous mycobacterium. and we've grown one of the biggest programs in the country. And so, and that was also just an opportunity. Somebody asked, can you see this very complex patient who's coming to New York and has NTM lung disease? I said, I don't really know that lung disease. I've never taken care of anyone like that. This was more than 15 years ago. But I said, sure, as long as you tell me what to do and help me with the case, I'll do it. And
Yeah, and
from
for
that
our
one,
listeners who aren't necessarily familiar, it goes from "I'm not sure" to one of the world's experts in this over that 15-year period. So to your earlier point, say yes, and you don't know how great it will turn out, right?
yes. So I love being a clinician. I love being a teacher, and I also do love being a wife and mother, and obviously have a large family up here. So spend a lot of my time really not walking too far because I live 2 blocks away from our hospital, and I'm always around. So it's been a great career over the last, oh my, started med school in '89. So whatever that is,
A
many.
few
Oh no,
years. I don't do
yeah.
that math anymore. I've stopped doing those numbers.
Oh, actually, I graduated med school in '89. Sorry, but
There you
anyway.
go. Very nice. Well, that's awesome. And it's interesting. I don't know if I'd shared this, but I have a link with Bellevue as well. When I was in fifth grade, I read The Making of a Surgeon by Bill Nolan, who trained at Bellevue in surgery, and that was my inspiration to go into medicine way back when. So, small world
It
stories,
has impacted many, many people.
many, many, directly and even indirectly. So,
Yeah.
you've taken on tons of leadership roles throughout this. A lot of it, as you said, people come to you and they recognize your enthusiasm and expertise for teaching and taking care of patients. We talk a lot about leadership on the podcast. Thinking back, when did you first say, you know what, I'm leading, and this is important. I have impact. How far back did that dawn on you, and did you become intentional about being a leader as a physician in your organization?
Well, you say as a physician, I think it starts even before that. I'm the oldest of four, so was pretty much always in charge of leading everything that my sisters and my brother did. So, kind of was in charge there from early on. I was the only one that went into a medical career. So also I think that elevated, where I was in the family tree because that was very much respected. But then, I think, really at the beginning, in my residency, I had a lot of great mentors to look up to. I not only wanted to learn what I had to learn, but I wanted to figure out how to make things better, how to grow things. I liked being in control of making those changes. I was a chief resident, which was an unbelievable experience again at Bellevue. A lot of autonomy, and a great number of interns and residents that you would have an impact on, as well as medical students. So I think it started really early on, and just really, my motto was, set the example that you want everyone else to do. And, they're going to, if they're looking up to you, the example you set is extremely important. I would never ask someone else to do something that I wasn't willing to do myself, or go that extra mile if I hadn't shown them that I would go there. So I think that's extremely important with the teams that you work with, and in leading teams. I think it makes your team a strong team. I'm always looking for my weakest link, because that's the person you have to focus on the best. So you're only as strong as your weakest link.
There you go.
But yeah, I really do think it came naturally in the setting that I was training in. And I do think that I love I love teaching others. And I love just trying to make things as good as they could be without, not caring about how much effort needed to go into some of those things sometimes.
Or not knowing, right? We start down a pathway not realizing, "Oh my goodness, this is a lot more than I expected to bite off here." So,
That's
yeah,
right.
for sure. You bring up a great point, and we talk about this a fair amount, that the whole question of, are leaders made or born? And when we look at someone and say, he or she's a born leader, That's usually into adulthood when we're evaluating people on their leadership qualities. But your point a moment ago is super important, that before you get into adulthood and people are saying, "Oh boy, that person's a real born leader," you've had many, many formative experiences. You talked about the fact that you were the oldest of four. And for that, or people who are growing up on sports teams, their community, their church, the way their family values are embedded, all of those things nurture any inherent leadership qualities that people have. So I appreciate you saying that. Um,
And I do think that my father instilled a lot of that within me.
Yeah.
Because he, even for women back then, there was nothing we could not do, no matter that you were female. And I could shoot a shotgun and, go hunt deer hunting, and I could get on a horse and go riding. There was nothing that he did not include us in. And I think that really made us feel like we could conquer anything, no matter what the obstacles were going to be. So I think that started at a very young age.
yeah, that's awesome. So that leadership quality going into medicine, the old saying that you don't grow pears on apple trees. So, you ended up where you were for a lot of good coaching and mentoring and love from dad and the rest of the family, I'm sure. We do grow and change. Um, any thoughts on how your leadership styles or educational processes that you've undertaken, courses, graduate programs, whatever, have purposely or even randomly, I guess, changed your leadership style, knowledge? How have you grown in that journey from, way back when as the oldest of four to now leading big organizations?
Yes. So I do think initially, and again, when I first trained back when, there weren't a lot of other resources out there, right? You just did what you had to do. You were thrown into a situation. Being here at NYU was very good place to be. I've been through a number of leadership courses. Some of them focused on administrative leadership, some of them more focused on in the medical education field. Most of those are developed by NYU. I've also been through coaching, one-on-one coaching. And you're very I love, probably started a lot of these 25 years ago, and you think, oh, there's nothing you can learn about yourself. You're doing everything so great. You're the best,
Aren't we
right?
though? Aren't we though?
And I do think I'm not a person who slows down or takes much time to reflect on a usual day, or at least takes time to reflect in how to change. And I didn't. And I can't tell you how useful those courses were. And some of those mentors, particularly in that space on how to become a better leader, self evaluations, 360 evaluations, looking at those, the coaching that I received to say, you're great at this, but look, you could get a lot more people to listen to you if you did this. Or, this is an area that maybe, at a meeting you could do better if you, did a little work behind the scenes, and that all little tools to help you navigate the system. But I learned a lot about myself. For me to slow down a little bit, to become a better listener and not assume all the time you know what the other person's going to tell you. Let them tell you. And I think it's really helped my mentoring of my fellows, particularly now my faculty. I'm the associate chief here, and have probably about 90 clinical faculty, or maybe, yeah, 90 clinical faculty with all sorts of questions and issues,
Oh,
and
yeah.
sometimes positive meetings, sometimes not. And I've
Mhm.
really learned to be a better listener. I think a much more objective listener too. Take the time to get all of the variables in and listen to a number of parties. I think that's helped a lot in a lot of my jobs. And I think also I'm a very loving individual and very empathetic, but taking the time to show that and to express that to members on your team, people that you're working with is very important. I'm always really focused on getting the job done. So stopping once in a while and smelling the roses and saying, here's why we're all here, and letting everybody understand that you are taking that time to stop for a second and think where you are. I think that's very important, particularly in a profession like ours in critical care, certainly in New York City, where you're rushing, you're always getting done. It's, stopping and reflecting along the way and including the people you're working with to understand that that's important is really been a big change. And I do that much more frequently nowadays.
Yeah, that's awesome. It's one of the key ways to restore your joy in medicine, right? I mean, if we're very transactional all the time, we got to get our notes done, we got to see that next patient, we got to move on to the next thing. And occasionally, even daily, if you can, to step back and say, oh, what we did for Mrs. Jones today is really amazing. And just sort of savor that, because we pretty much do amazing things every day, even if it's just comforting someone, not necessarily a heroic victory, but that can really make a difference in, I think, decreasing burnout and restoring joy in what we do. Because we get so good at saving lives and comforting people that, it doesn't strike us as special, but it is special.
It is. So stopping to say that or say something nice, I always assume, what if I wasn't here tomorrow? What would I want to make sure I did today? And,
Ah, nice.
so saying thank you to somebody who's been, really there, remembering to appreciate them. I think just stopping and thinking about that and thinking, you can really you can change the way the day goes if you put a few of those little reflections in there. So I do try and do that more frequently. Sometimes I have to remind myself to do them.
We all do. We all do.
But yeah, and then I just think learning more about yourself through this process is incredibly important. Incredibly important. And having others reflect back on you that you trust and get good feedback is key. It's key.
Yeah, so true. Earlier you talked about listening more, and I'm always fond of the saying that, God gave us two ears and one mouth for a reason. But your global comment around that was really profound. The idea that reflecting on your capabilities as a leader, the impact that you're having, the good, the bad, getting feedback, all of that rolls into a concept that we talk about a lot, we've written about, that unless you recognize that you're leading, unless you recognize the impact that you have as a physician, and quite frankly, just as a human being, but in a healthcare system as physicians, we all have impact. And if you know that, if you think about it, then you're going to reflect on, how can I do that better? Occasionally we all have uncomfortable interactions. I'll get your thoughts on this, that if you don't recognize the impact you have on the organization, you may just walk away and go, what a jerk. But if you think, oh my gosh, why was that uncomfortable? How did it impact that person? How's it going to affect the team that observed me in this uncomfortable situation? It really changes how you deal with those really good moments, tough moments in what you do. So advice to, other doctors who may be going down that transactional pathway and just, leaving a wake behind them that they're not intentional about, versus what you were describing of really trying to get better.
Yeah, I think we always worry that if we put a little bit more of that reflective time in our day, we're not going to have the time to do the things we have to do. And in fact, I think it saves you time in the long run. If I go into a patient's room or a patient's exam room in the clinic and I'm more relaxed and I say to them, "Hi, Mrs. Jones," and talk to them about something even not related to their CT or PFT they had that day, but how's your daughter doing? Or, whatever that connected thing I have with them, automatically they are less anxious. They hear me better. I hear them better. They ask less questions. And a lot of this has been documented and, through a number of studies. So I really think that even doing that, try and stop before I go in the door of every patient's room. And I did learn this through the first 5 minutes program I did with chest, which I had a big one here, which is a great program on learning how to better understand your patients in those first 5 minutes. Just stopping before you go in the room to say, because most of the time I'm eager to tell them what their CT showed or what their PFT showed, instead of saying, who is this patient? What do we know about them? Let me go into the room with that feeling. And then we'll get to the CT and the PFT, and not putting my hand on the door when I think I'm ready to leave, and making them even more anxious, and asking, do you have any other questions? So I think the more relaxed I am and the more I am interested in who they are as a person, in addition to them being a patient, makes the encounter go much smoother. I think they're more satisfied, and I even think I save time. So, yeah, I think it's really important to build that in to your day to day, whether it's with your team in the ICU, whether with patient families in the ICU. I mean, we're so used to everything being transactional and business based, we forget about these other pieces that in many cases could save us a lot of time.
Yeah, and we're dealing with folks who are in the situation that they hoped probably they would never be in. I mean, a very few people go to a doctor's office because it's fun. It's their preferred way to spend an afternoon, right?
Right.
Or certainly a hospital. And again, we are so inured to the environment that, if you don't recognize what baseline stress they and their family are under, just because they're in your office or in your hospital, then you're missing something there. And changing it as you described. Yeah, I'm privileged to take care of almost exclusively kids now. And so, walking in with, some cat ears and whiskers drawn on your face, or, crawling in the room and sneaking around the bed and tickling them, it changes the entire dynamic, right? And the parents, I don't do it to make the parents melt, but they kind of do. They're like, oh my gosh, this old grandfather really knows how to, show a 5-year-old that he really cares.
Yeah, and too, much of the disease and suffering that our patients have, yes, it might be in my case due to their pulmonary comorbidities, but a lot of it has nothing to do with their lung disease. A lot of it might be due to anxiety or loneliness, or you can just, or other issues they may be having with finances. So I do think talking to them as a person in addition to the patient, and trying to understand that you are there for them is really helpful in the healing process. And that relationship is really, really important. And patients do, I mean, they really look up to their physicians. I mean, I know people say things have changed in medicine over the last 50 years, but most patients, really have the utmost respect for their physicians. And I think that's, we have to make sure we uphold that. And I think if you understand that, that you're really valued,
Yeah.
you will look at that relationship differently.
And once again, similar to as we talked about earlier with the fact that you're leading healthcare teams, you're really leading patients and families too, where if you look at a fundamental definition of influencing behavior to achieve a desired result, the way that you communicate has significant impact on really they're getting better, whether it's compliance with therapy or just psychologically saying, somebody cares about me, somebody listened to me and are really helping me on this journey, I think makes a huge difference instead of, being
100%.
a holographic doctor who walks in and, gives some test results and a plan and walks out. That's not enough.
And it's important too to understand when you are moving into that kind of burnout phase. We all can get there. Not enough sleep, not being able to understand that you're at that point and making some changes, even if it's just temporarily. But I think that's important too. Putting yourself in an environment where you do have other people that can help you, very important for those, whether it's doctors or leaders in any profession. Making sure that you're in an environment where you have people that you can talk to, because you got to take care of yourself in order to be able to be the best leader that you can be. If you're not taking care of yourself, you're not going to be able to achieve what you really want to achieve.
Yeah, true enough. Physicians, just like world-class athletes and senior executives, I think can benefit from sharing key practices essential for peak performance. If you look at elite athletes, they rely on coaches. Even Michael Phelps, the greatest Olympian of all time, had a coach throughout his career, right?
Right.
So we're going to stop here. Coming up next on All Physicians Lead, Dr. Doreen Addrizzo-Harris, professor of medicine at the NYU Grossman School of Medicine. We'll discuss setting the tone for the next generation of doctors.
I do think expectations that you set as a leader and how you live those out is really, really important for the other physicians that are coming up the ranks. We really have to set the example for them. And I wish and I hope that, everyone who's a physician can get joy out of the work that they do every day, because it is so important and it is such a calling, and I do think such a blessed calling.
This has been All Physicians Lead. We can all be better leaders, and our teammates and patients will be the beneficiaries. Go to allphysicianslead.com to unlock your potential, sharpen your impact, and elevate your journey. All Physicians Lead with Dr. Leon Morse is a production of Forbes Books.